Hey everybody, I want to talk to you guys today a little bit about pain in the back of the knee and what you can do about it and what might be causing it. Whenever people have pain in the back of the knee, for some reason, a lot of the time, therapists like to act like it's coming from your hamstrings. And I think maybe, like, it's really rare that it's coming from the hamstrings. Maybe like 10% of the time it is. Usually, where it's coming from is a hyperextended leg. So what I mean by that is your knee should always be slightly bent. It should never just be fully locked in and extended. And so what causes that fully locked in and extended is it's got to be one of the two muscles. So either usually what's happening is it's the gastroc muscles which attach just above the joint. And if those guys get really tight, they'll hyperextend the leg there. So that's the most common one I find personally. And then the second thing I find is that someone has an anteriorly rotated pelvis. And so when you anteriorly rotate, you bring the origin and insertion of the hamstrings further apart, forcing a hyperextension in the back of the legs. And so that's the second most common. And then the third most common is to have it from the hamstrings, but it's less likely because usually you get a posterior pelvic tilt, and so usually that gives it a little bit of slack, and so it's usually very rare to create that hyperextension. At the same time, if you had injury, like something just happened, and that would cause, like you were doing a sport or you were pivoting on your foot one day and something in the back of your knee started hurting, it's really good to first go get that checked out by a health practitioner just to make sure it's not a ligament tear or stretch or hypermobilization or a meniscus tear. Get that checked out because those are pretty serious injuries that take a long time to heal, and you don't want to do anything to make them worse. But if that's not the case, it's got to be one of those three. Start with the soleus. Here's how you do the soleus stretch. So you can do this one against the wall. I like to do it on a textbook, like a really thick textbook, and I'll explain why right now. So get yourself a textbook, and what you're gonna do is put the base of your foot on it. So just right there. And you're going to hyperextend the legs, so you're going to lock it in, and you're going to step in front, and you're going to feel a great stretch in the back of your knee. Some people may need a thicker textbook, so make sure the textbook's thick enough to give you a good flexion in the ankle, and then hold that guy for 2 minutes and repeat 3 times, and you should get some great relief. So just knowing that if you do that and you feel the stretch right where you feel your pain, I mean, you're probably nailing it right there. And then if you don't have a thick enough textbook, you don't have a textbook, what you can do is you can do it against the wall. You just can't you can't step past the other foot, but what you can do is lean into it. So again, foot up, make sure it's the base, so heel on the ground, and then the base of your foot touching the wall, and then hyperextend, and then lean in as close as you can to the wall. And again, you should feel the stretch in the back of your knee. Hold that guy for 2 minutes, repeat 3 times, have a hot shower, hot bath before you stretch, calm the nerves, make it more effective. And hopefully that's the most common one, so hopefully that gets rid of the pain in the back of your knee. So try that guy out, smash up the likes, subscribe to the channel, and comment below. Let me know how it works for you.